guess I'm ready. Good afternoon. I'm Muriel Bowser. I'm the Mayor of Washington, D.C., and today I am going to provide a COVID-19 update and the district's response. Additionally, we will provide a public safety update. I'm joined by members of my cabinet who will assist me in discussing these issues. I want to start today by noting that it's hot. It's very hot. And I have activated a heat emergency and opened cooling centers across DC. These sites are open to all who need a place to cool off, and you can learn more at heat.dc.gov. This, of course, is part of our normal summer planning. We've been asked about it at a few of these press conferences, and with today's weather, we have had to activate a heat emergency. Heat.dc.gov, and if you would like to request transportation to a cooling center for a person experiencing homelessness, you can call our shelter hotline at 202-399-703. And on the screen, you can see the cooling centers located in all 8 wards. We are, of course, 1 week into phase 1, and we have continued to release COVID-19 data each morning, and we will talk more about that in a bit. The data does not reflect the effects of phase 1 or the activities of the past week. However, this morning we announced 79 new confirmed COVID-19 cases, bringing our total positive cases to nearly 9,200. We also tragically lost 4 additional Washingtonians to the virus. And you can see from the chart here that we have experienced 4 days of sustained decline in community spread. And Dr. Nesbitt will talk more about that. So what does this mean now that we are in phase 1? I want to share with you today the metrics for entering phase 2, and I also want to talk about what we might see in phase 1 that would cause us concern and that might require us to put in interventions. So you can see here the metrics that DC Health will elaborate on at this time. So Dr. Nesbitt, if I could ask you to walk through slide 3.
Sure. What we are presenting here are the metrics that we will be using as we are currently in phase 1, and will help us to make the decision about transitioning into the next phase of our phase 3 opening, phase 2. We have talked quite a bit about a sustained decrease in community spread and the need to observe 14 days of decrease. This one is a bit tricky, so I want to make sure that everyone has context for understanding how we will be observing 14 days of decrease. If you go back to the previous slide, this is how we will be presenting this on a dashboard where you will be able to observe our progress toward meeting all of our metrics. The dashboard will go live in the next few days. You will notice that there is a shaded area, the gray area. The first part, or the beginning line description of the gray shaded area indicates when we chronologically began our phase 1. From a calendar date perspective, that aligns with May 29th. This graph, however, depicts symptom onset date. So the symptom onset date aligns with May 22nd. In order for us to really begin to make observations around the impact of the phased reopening, that time period begins to align with the symptom onset date associated with May 29th, which aligns with the calendar date of June 5th. So that's where the green box begins. So while we do want to observe 14 days of decline, In reality, our experience in really beginning to see the impact of the phased reopening or any cases that are associated with the phased reopening begins with the green shaded area. So we want to see 14 days of decline. Do we still have days of decline since we moved into the phased reopening? Yes. That tracks as 4 days, but really beginning to see 14 days of decline associated with the phased reopening would begin in the green shaded area. If you go back to the metrics document, low transmission rate, so we want to see a transmission rate less than 1 for 5 days. The basic reproductive number of low transmission rate tells us the likelihood of an infected individual spreading the virus to other individuals. In terms of testing capacity, we want a low positivity rate or a testing rate to be less than 15% for 7 days. I've explained this one before in that we don't calculate our testing or positivity rate in terms of the total number of tests ever done in the city, meaning the total number of positive tests that we've ever had in the city over time since we began testing back in January, over the total number of tests ever done in the city since back in January. But we look at this metric on a daily basis, and we want to have observations of it being less than 15% for a 7-day period. The healthcare system capacity, it will be better for us to be able to have no crisis care in the district. So having our health system capacity be less than 80% for 14 days is one of the observations we want to be able to make. And then our public health capacity is measured by our ability to do contact tracing. So making a first contact attempt for new positive cases within 1 day of us being notified of the case, and having that be over 90% of the time. And then a first contact attempt for close contacts of new positive cases once we are aware of who those contacts are. So that means that once we have the list of the contacts from any positive case, that we have been able to make contact with those individuals within 2 days of being notified of who they are, and having that occur 90% of the time. You can see where we are in terms of progress for meeting these phase 2 metrics as of June 3rd. The next slide indicates what would be our triggers for possible interventions. And again, just comparing where we are today. And it's important to note that we refer to this as a trigger for possible interventions because we can look at this as more of a dial, right? So we call this a phase reopening, and we have the latitude to implement more strict interventions in any one of these categories, or what we call our non-pharmaceutical interventions, depending on any of these things creating us alarm. And so we're kind of sharing with you some of the ways that we think through areas that would be of concern for us. So an example would be if our hospital capacity were to become over 80% for more than 7 days, we would have consideration for implementing possible interventions around our healthcare system. So as we moved into a phased reopening, we were able to have conversations or issue guidance rather with the healthcare system around allowing elective surgeries in the inpatient environment and ambulatory care surgical centers. And so if our health system capacity were to exceed 80% for more than 7 days, we may have to have a consideration as to whether or not that should continue, or we would need to have some dialing down of that type of intervention.
Thank you, Dr. Nesbitt, for that. And I know there'll be questions, so let's get to the rest of the information, and then we'll pause for questions. Let me also talk about a little bit more about contact tracing, which Dr. Nesbitt already mentioned as part of our metrics. And we also think the training for contact tracing is helpful to our entire workforce. So DC government department employees will be trained and ready to support the contact trace task force if called on. Additionally, in June, all of our employees, as I mentioned, will complete an online training. So we're happy about that. Further, I have been talking all week about our planning around making free COVID-19 testing available at our fire stations. And so I want to ask Director Geldart to talk a little bit about that.
Thank you, Madam Mayor. As we expand our ability to continue to test folks in the public, those who need a test can get a test. We have several of the engines across the city, several of the firehouses across the city available for folks to come to. We also realize that our other testing sites, such as our walk-up site on F Street Northwest, which does not require an appointment, are daytime test sites, so they run from 10 o'clock until 2 o'clock. The ones that we're doing at our firehouses, we wanted to ensure that there was more availability, so they'll run from 4 o'clock in the evening until 8 o'clock in the evening. So those folks that can't make any of our other test sites have the ability to go to any of these firehouses on any of the given days when they're scheduled, or when they're scheduled to be opened, I should say. Folks can get their tests at that time.
So, and the personnel who are going to do the sampling?
Yes, ma'am. The personnel at the firehouses will be our FEMS personnel, so they'll be our paramedics and our EMTs that have been specially trained to do the testing for COVID. So that's who will be conducting the testing at those sites.
Okay. Thank you very much. And so we have a map and the locations. Let me just read through them. Engine 4 in Ward 1 on Sherman Avenue, Engine 8 on C Street Southeast, Engine 10 at 1342 Florida Avenue Northeast, Engine 11 at 3240 14th Street Northwest, Engine 12 at 2225 5th Street Northeast, Engine 30 at 5049th Street Northeast, Engine 31 at 4930 Connecticut Avenue Northwest, and Engine 33 at 101 Atlantic Street Southeast. And there may be an additional station that goes on, but these stations are open and available. So if you need a test, get a test, you can walk up to those locations. You can call our 1-800 number. You can go to your private provider. So we want everybody who needs a test to get a test. Next, I want to announce that starting on June 18th, DC Public Libraries is permitting curbside pickup of books that you have requested, as well as remote printing at the following locations: Anacostia, Benning, Cleveland Park, Mount Pleasant, Northeast, Shepherd Park, West End, and Woodbridge. So if you would like to reserve a book for pickup, call the library or use the chat feature on dclibrary.org. So that is very good news. We also want to share that DC Public Schools is sharing a family survey. So please share your input on how students can engage in learning during the 2020 and 21 school year. Go to coronavirus.dc.gov/our-schools. So with that, I want to turn to Chief Newsham for a brief situational update, and then we'll take your questions.
Okay, good afternoon. Thank you, Mayor Bowser. I have not had an opportunity to publicly thank Dr. Nesbitt for the steady stream of precise information that she's given to all of us to better understand this virus. Thank you, Dr. Nesbitt.
Thank you, Dr.
Yesterday marked the 7th straight day of protests in Washington, D.C. That we've seen. Like the previous evening, MPD did not make any arrests. All of our arrest information, as you know, is on our website. Just to walk you through the days, Saturday we had 19 arrests, Sunday 90, Monday we had 289, Tuesday 29, Wednesday 0, Thursday 0. Those are the numbers when we have demonstrations in the city that we're used to, and we are hopeful that tomorrow will be the same. Talking about tomorrow, we anticipate the largest demonstrations with regards to numbers that we've seen in the city to date. and we anticipate that the protesters will continue to be peaceful as they have been over the past couple of days. Another a note that I want to mention is the Metropolitan Police Department has a heavy heart today for the passing of one of our senior police officers with over 30 years of service. I want to publicly thank the mayor for sending her condolences to me and the rest of the police department on that loss. He was a resident of the state of Maryland, so he did not live here in the District of Columbia. His name is Officer Keith Williams, started his career in 1989, served in various assignments throughout the city. Most recently, he served in a critical role as one of our school resource officers in the 3rd District. He passed away yesterday when he was surrounded by loved ones. At this time, we preliminarily believe that his death is associated with COVID-19. And I just want to extend my sincere condolences to his family, his wife, his 4 children, his granddaughter, all of the men and women at the Metropolitan Police Department who are saddened by this, and his friends. And I want to turn it back to Mayor Bowser.
Thank you. We'll take a few questions. Yes.
Mayor Bowser, what do you say to those restaurant owners who still cannot have customers inside their businesses because of COVID, as hundreds, thousands of people hit the streets for protest? What is your message to those business owners? What is your message to those protesters?
Well, our message is really two separate things, and certainly we are concerned. Actually, I just had this conversation with Dr. Nesbitt about large gatherings, about people wearing masks, washing their hands, and if they're sick, not coming down and not being around other people. If they're traveling here from other states, that they think twice about coming to DC. If they're feeling sick, if they don't feel like they can socially distance where they may be staying. All of those things are critically important. We don't know what the impact of these demonstrations will be on our COVID experience in DC. We hope that we won't see a spike. And we have to measure everything that happens that's within our control and not within our control. Because the bottom line is this: we still have to be able to accommodate anybody who gets sick and needs to go into the hospital. Yes, Mark.
Chief, first of all, condolences on the loss of your department. Thank you very much. I'm sure we're all very sorry, as you are, to learn that. But my first questions are for Dr. Nesbitt. Doctor, and I've got a couple on the new metrics. So if I'm looking at the metrics correctly, well, first, what is the start date of the 4-day? Because you had mentioned May 22nd was onset date, but calendar date was June 5th. So when we begin this 14-day community spread downward trend, what date did that start on?
So I want to make sure that I can make things very clear and manage expectations. We continue to count the number of days of decline that we have, but when we are looking for 14 days of decline to make a decision and a recommendation to the mayor about a phased reopening, the earliest that we would make a suggestion about a phased reopening, because we've fully seen the impact of what the first phase of activity gave for us, would be June 19th. So for as much as we may be counting 14 days, and you may see continued decline since we moved into May 19th, I would think it premature to on June 12th suggest, or June 13th, suggest to the mayor that, okay, we can go ahead and have a phased reopening for phase 2. The reason for that is that every time you make a substantive change to your non-pharmaceutical interventions, meaning that you're allowing more activity, you want to fully be able to appreciate what the previous change caused in your community. It takes about 3 to 12 weeks to fully be able to see what those changes have caused. And you could see there, we've cited some other professional and public health organizations and public health experts who have documented this work based on past epidemics, past pandemics. in particular related to this virus, the incubation period for this virus is itself 14 days. So the actions that people started taking on May 29th would not manifest themselves for the following 2 weeks. So they're not measured in our community for a full 2 weeks afterward. So again, we will continue to keep counting, as you can see, these numbers of days of decline. So if we didn't count anything for the first 7 days, that gray box would just be there. It would just be nascent, right? There would be nothing going on. We could do that and show no days of decline for this past week, or we could continue to count those 4 days of decline plus the 14 days when we fully see the impact of what human activity and human behavior since reopening causes.
June 19th, to be clear, is the soonest date. If everything went your way, went our way, June 19th would be the soonest date you would recommend.
Thank you for the clarification of your statement. If everything goes our way, because we're all in this together. The health department is the ones following this from a health metrics, a public health metrics, and an epidata perspective, but it's what we all collectively do in our community that drives how we make recommendations about what it's safe for us to do next.
June 19th would be the earliest.
That is correct.
Okay, so then if I look at this, the metrics that you have, and you have 1, 2, 3, 4, it looks like 5 white lines there that we're looking at 4 days, 0.82. It looks like, are we not at any of those benchmarks yet? Am I reading
That is correct, Mark.
So we're not at any of those benchmarks.
And we need to, all 4 categories have to be met in order for DC Health to make a recommendation to the mayor about the next phase.
Thank you very much.
Yes.
Yes. Can you clarify how you're measuring the positivity rate for 7? Is that like the number of people tested on a given day who test positive, or there's a 7-day average?
No, it's the number of people who test. We look at the number of tests, the people who test positive on a day divided by the number of tests on that day. And then we look at that trend, how it is over the 7-day period, right? So it's not one of the things that we look at from a rolling average. But when you look at the dashboard, it will tell you how we calculate each one of these numbers. One of the things that I want to caution you, though, is that it can change every day. So we can post a positivity rate for a particular day, and then the next day, that number changes. And here's why. If we have lab results that come in because somebody had a backlog, the previous positivity rate that we calculated for June 3rd could change 6 days later. We may be able to change it because more labs came in from that specimen collection date.
So we're not looking at the most recent 7 days. We're looking at 7 days that are somewhere.
No. June 3rd would still be part of this 7 days, right? Because we're on the 5th. So if we're calculating for the most recent 7 days, you want to look at recency when you're talking about positivity rate. So because sample collection date is what we look at, if somebody has a backlog in their lab, like earlier this week, I had some days that looked like only 600 tests were done. And I had a commercial lab that had a backlog, and now I know that 1,100 labs were actually collected, specimens were actually collected on that day. So the denominator changed, which in most cases will make the positivity rate that was previously calculated on that date go down. So if you divide, yeah, well, she was not, she shook her head like she didn't understand.
It was clear.
Do you understand? So if you divide 200 by 600, the percentage is 33. If you divide 200 by 1,000, the percentage is less, right?
Right, but presumably some of those other 400 also tested positive.
Right, but more often, when we get an influx of labs, the majority of them are negative.
Okay.
Yes.
Oh, so let's say it's, what day was it? It's June 19th. Like, what would trigger a return to the original March stay-at-home order? Would it be if we, like, what would trigger a phase 0, or should we not be thinking about that? Would it be?
I think what Dr. Nesbitt has explained is that we see it as a valve going on and going off. And so my expectation would be that the health department would consider some things that had to be turned off. For example, I asked that question, of course, of the health officials, and one very good example that Dr. Nesbitt gave is that if we thought that we had some hospital capacity problems, that wouldn't trigger going back to staying at home. That would trigger interventions with our hospital providers.
And I know you mentioned, Mayor, a lull in testing. I've noticed like a plateau of positive cases. I wonder, are we not doing enough testing? What are you seeing on your end?
So one of the things that I mentioned in sort of the example that I just gave is that we, when we see a decline in the number of tests that are being reported to us, we make a lot of calls to a lot of different people to be able to understand why that may be occurring. Some of our labs this week were reporting to us backlogs. So we were able to get a little bit more of an estimate as to how much of a factor that was contributing, and it is contributing some factors. Earlier this week, the mayor emphasized that the other events that are happening in our country and in our community may be playing a factor in how people are deciding to get health care. So we need to see how much that is contributing. We are still seeing people getting tests close to the 900 tests a day. So the declines, while they are concerning, because we had a day where we had over 1,800 people getting tested, which was, while we haven't set a number of tests per day, and over half the jurisdictions in the country are similar to us in that regard. We want to make sure that we aren't dipping very low to where we're only having 300, 400 people getting tested per day. So we wanted to be able to make calls out to our healthcare providers, to the labs, to be able to see what's going on. We'll keep our eye on that. We'll see what happens over the next few days in terms of if we're getting more labs in from labs who were reporting backlogs, to be able to make observations around that.
Sorry, just a quick follow on that point about we don't know how the situation now is playing out. Would you say that perhaps like law enforcement tactics, I'm thinking now of tear gas, do you think those could, in your expert opinion, exacerbate the spread of this virus? And is that, what do you make of that?
I'm not aware of any correlation between the way that you just posed the question to be able to opine. So then I'll just leave it at that.
Yes, James?
Yes, Mayor Bowser, I have a question for Dr. Nesbitt and a quick one for Dr. Rodriguez on a slightly different subject. Dr. Nesbitt, in terms of testing east of the river, particularly the new setup that you have near the big chair, do you have a sense, and you don't have to give me hard numbers, but do you have a sense of folks going into that facility and getting tested?
Sure. So I have visited the site. And of course, am in contact with our team members who are at the site, and so is Director Geldart. With the relocation of the site, we were anticipating that we would get more people to walk up because it is more accessible by public transportation, which was one of the reasons that the mayor wanted to create a more accessible site, and we saw that. In the first day that people would walk by, inquire to what exactly was happening there, because of the unique way that these sites look visually. And we did have quite a few people come on the first day for walk-up testing. So the walk-up testing numbers look good to us from the perspective of what you could expect in the first week. I'm not overly concerned about low uptake of the site in the first week in terms of the drive-through. A lot of the people who drive through the site are intentionally coming as a scheduled appointment. So I feel really good about the new location. I think it is centrally located. And I also want to make sure that I'm calling attention to the firehouse that has been located there, as well as some of our health center partners like Family Medical and Counseling Services that is located in Southeast, that is really beginning to ramp up the testing services that they offer at their location.
Dr. Rodriguez, you and I had this question for you about a few weeks ago, but things have changed. We're now in hurricane season, and could you just stress to us again, with COVID still circulating around, what is the city preparing to do if we have, God forbid, a hurricane to come through this area?
Thanks for the question, and you correctly note that this week marked the beginning of the 2020 hurricane season. We've already had, I think, 3 named storms already, and I think the first one started even before June 1st, which marks the beginning of the season. We are capable, and we do have contingency plans to manage multiple incidents at a time. The EOC is activated and will remain activated for the foreseeable future until the mayor deems otherwise. Just this week, we also engaged in a workshop with FEMA and our FEMA region, and so there's a lot of planning going on in the background to make sure that the district is prepared for any type of severe weather event, even under a COVID emergency.
Other questions? Yes.
Just a couple more COVID questions. Can you, Mayor, tell us any idea of what phase 2 might look like? I know you've gotten recommendations from the task force, but could you tell people what they might look forward to June 9th if everything goes our way?
Let me turn to Dr. Nesbitt to just give some of the highlights of recommendations from phase 2. And you're right to say they are recommendations. I have not drafted the order to put them in place as yet. We had some questions from the community and business community and arts community. I know about a few issues. I don't think that they're phase 2 issues, but we are examining those.
Yes. So in the recommendations, you may recall that in phase 2, we would anticipate being able to allow the size of small gatherings to increase from 10 to possibly 50. Also allowing for the beginning of some indoor dining to resume with the appropriate types of social distancing, but the type of dining would also need to be monitored. So not resuming buffets, still restricting the use of bar areas, things of that nature. There would be some expansion around the non-essential retail as well, still having to have some of the strict internal social distancing in place. We would also anticipate an expansion of some of the personal care services being able to come online, and an expansion of some of the recreational activities in the district.
Okay. Last questions? Yes.
Yeah, just 2 more on COVID. Dr. Nesbitt, I heard you in today's council hearing talk about preparations for a vaccine. I understood those to be like logistically preparing and such. Can you just talk more about that? Like, you mentioned something about vaccines being like, when that happens, who knows when that'll be, but it'll be available to everyone. I'm just trying to get a better sense of how DC Health is preparing.
Sure. So you all may recall that supply chains were really tough around testing. And so we know how to run mass vaccination clinics. We've done them before related to H1N1. We know that there are basic things that are needed when running mass vaccination clinics. And so we've leaned forward in that regard in terms of being able to be prepared. We've also started to think through the logistics planning for mass vaccinations. In terms of preparing and will everyone have access, you know, there are certain things that when vaccines are made available and the safety of vaccines, the different manufacturers make the decisions around who are eligible in terms of who the vaccines are being tested for, right? The different types of age groups. So which ages, if they're appropriate for infants, if they're only appropriate for adults. So we'll have to wait until those trials are finished and until a safety is determined. But it is always our goal to have them equitably distributed across the city. When we ran our mass vaccination clinics for H1N1, we hosted a number of clinics simultaneously on the same day at multiple high schools across the city. So that's the level of logistical thinking that we're doing at this point. Doing procurements around it so that we're not left on the outside trying to compete for the same supplies as other jurisdictions.
And one last question about, I know you haven't written the phase 2 mayoral order or any, but I wonder, when should businesses like at least expect guidelines as far as like how like in preparation for a phase 2, or how they could like prepare beforehand?
That's a great question. And we recognized in preparation for entering phase 1 that we needed to help people think through some of these issues. We have a lot of people thinking about them. Outgrowth of that was having these care packages that had masks and sanitation supplies, especially while supply lines are tied up. We've also put out some checklists for businesses and other ways for them to think about reopening. And we were able to do that about a week out the last time, and our teams will be thinking about those now. A lot of what we have done already in terms of the guidances that the Department of Health has put out, plus some of the checklists that have come from our DMPED and planning and DSB, they would more than likely also impact the things that are turned on in phase 2. So we have a lot of that work done, but we will look over it more to make sure that we can support our businesses as best we can. Yes.
Can I ask you a couple questions about some things going on in DC today? First, I'd like to start with the National Guard, and I know you mentioned some of this outside of St. John's earlier today. We are learning from the DC National Guard that some of the Guard members were quartering in hotel accommodations that had pre-existing contractual agreements with the district. Can you just please explain, what led to this? What was the contractual issue?
Sure. So let me, I'll try to be as specific as possible, but I also want to call attention to a tweet I sent out to Senator Lee. I haven't had a chance to talk to him, but the message was meant for him to get, is that at no time did we intend, or certainly would we be able to affect evicting any guardsmen from any hotel. We do, however, have an agreement with one of our hotels for our COVID response, for which the district has paid, and the district has a contractual arrangement. So our message to the hotel was that if they're going to use the rooms that we reserve, then they have to pay for them, or you have to refund us our money. And that we understood would just be a matter of the Guard or the Army making those arrangements. So those out-of-state troops would be covered either by the Army or their home states, not by DC residents. You may also know that this morning or late last night, we made a formal request that those out-of-state troops be called home. Yes.
And just to follow up other actions outside of DC, the mural now, DC murals that you talked about, what led into that? I understand DC murals is something that targets areas that you said are, targeted by graffiti, but was there a collective discussion had? Is this something that the city pays for? Can you talk about how that all came
Well, I'll just say that all the great ideas, my team and the 37,000 people that work for us are generating ideas every single day. And I'm grateful to Murals DC, which is run out of our Department of Public Works by Director Geldhart, who really implemented a plan to have that done. And we know what's going on in our country. There's a lot of anger. There's a lot of distrust of police and the government. There are people who are craving to be heard and to be seen and to have their humanity recognized. And we had the opportunity to send that message loud and clear on a very important street in our city. And it is that message And that message is to the American people, that Black lives matter, Black humanity matters, and we as a city raise that up as part of our values as a city. And so I'm very grateful to Murals DC at a DPW, a great team of artists who got it done and implemented it. And that's it. Yeah.
Chief, could I ask you a question looking forward to Saturday? Could you give any indication that you say it's the largest crowd you anticipate this week? I'm wondering if you could put some numbers on that. Do you have any intel on how many people you expect to see? And do you have any idea, I know they're a moving group, but do you have any idea where they may be headed, where they might go?
So with regards to numbers, the answer to your question is no. We anticipate numbers that are larger than any of the numbers that we've seen to this point. We have a number of ways of trying to determine the number of people that are coming into the city. As you know, we're in a COVID environment. So normally one of those measures is the buses that may be coming into the city, and that is not a measure that we will have. But we will have measurements of people that will be coming into our city by foot and by metro. The critical thing for us in ensuring that the city is safe when we have large gatherings outside of the public health issues is to ensure that we don't have people who are going to be inclined to be involved in bad behavior. So that's more of our focus than the actual numbers. I mean, if you talk about large events in our city, we go all the way large 5,000 to, if you look at the Women's March on Washington, some folks would say that was as many as 1 million. So that's the best estimate I can give you on numbers. I understand that this event will not only be held here in Washington, D.C., but other major cities. So it'll, like I said, it's that will is an indication to me that it may not be as large as the Women's March because that was a singular event here in the district.
Mayor Bowser, I know you just checked Twitter and saw the president's comments calling you incompetent with a budget that's out of control, constantly asking for handouts, and he threatens that if you kick these men and women out, he's speaking about the National Guard, I assume, that he will send a different group of men and women to the district. I know you just read this tweet, but I have to ask your reaction.
Listen, there are so many things that I could respond to in that tweet, but I think that we all have to just refocus on what's in front of us, and that our nation is hurting. It's in need of healing and leadership at all levels, all the way from the top to mayors like me and to all of us, to focus on how we bring people together. And I want to be real clear. I already said in response to an earlier question that while we don't want guards from other states who've come in without our request. Now keep in mind, we work with federal partners, we work with our jurisdictional partners that surround us, we work with National Guard from other states all the time on major issues, and we've been able to do that cooperatively. This is a difference. This instance is a difference, and so we want all of those troops to be accommodated. We don't have any issue with them being accommodated in DC hotels, but they have to be taken care of by the Department of the Army. The DC National Guard General Commander, the General in Command just briefed me that his office was working with contractual arrangements with the hotel for the guardsmen that he is responsible for.
So can I just follow up with two things?
Sure.
One, can you address the President of the United States publicly calling you incompetent?
You know the thing about the pot and the kettle?
And then, can you kind of explain to us who are those troops that are at the Marriott Marquis being forced to leave, or are they going to be able to stay?
It is not my understanding that they're being forced to leave. They may have gotten a direction from the hotel, and that is, if that was the direction from the hotel, it is certainly not our intent that these soldiers not have a place to stay. It is our intent, however, that whoever ordered them here and is responsible for it is the Army, their governors, that they take care of their accommodations. So I hope that's clear.
And then can I ask about the deputizing of some of these out-of-state National Guard by a MPD lieutenant? What is the status of that? Do you know how many National Guard, where they were from, and has that been rescinded yet?
It has. So we, the general informed me, and this is that he has 5,000 troops, the Guard troops, under his command. And for people who are watching, they may not make the distinction about the DC National Guard is different from state guards in that it's already federal. But I understand, and there's some questions about chain of command with all of the federal assets, but I understand that all of the out-of-state troops are in, I should say National Guardsmen and women, although actually I haven't seen any women. Have you seen any women in the Guard?
I'm sorry?
Have all of the Guardsmen that they send all men? You've seen women?
Oh, I've
Okay,
seen women.
all right, so there are women Guardsmen, I just haven't seen them. But I lost my train of thought, but all of them are under he told me, or under his command. Did I answer your question?
So they have been, your order has been rescinded. Was there a number of
That were deputized? I'm not exactly sure how many were deputized, and we went into this, and the chief can say a little bit more, recognizing that when we call up the Guard, and we did, and we called up DC National Guard, that we deputized them, and it would appear that General Walker requested that they all be deputized, and MPD did that. We won't be doing that anymore. Yes.
Chief, my condolences on Officer Williams as well.
Thank you.
We'd like to ask you, with regards to what is expected this weekend, can you shed a little bit of light more on who all, when you talk about a relationship with federal partners, are you calling any more this weekend? And also, Mayor, if you could also answer this, is there potential for another curfew to be implemented this weekend?
So I think our position has remained pretty consistent as to who we're working with. We're working with the federal partners that we always work with in Washington, D.C., U.S. Park Police, U.S. Secret Service, ATF, DEA, FBI, and that happens in Washington, D.C. on a regular basis. And then for operational purposes, we have asked the D.C. National Guard to assist, and I don't think we've wavered from that since day one. That has been our request, that it be DC National Guard, and that's hasn't changed. And was there a second part to your question?
Curfew?
Oh, that's the mayor's decision on curfew.
Well, the chief will let me know what the public safety needs are, and we'll make a decision about that.
Is there any kind of timeline, like by?
We'll do it early in the day tomorrow. Yes.
Yes, after your strong demonstration this morning with Black Lives Matter on 16th Street, I wanted to ask whether you support the proposals before the council to reform policing, including requiring that an officer involved in the use of force name be disclosed within 72 hours, or banning MPD from using chemical deterrents.
I will have to read the council's proposal. I was briefed on what the subsections are. I don't know if a draft has been released. You have a draft?
There's a summary draft that's...
Okay, so I haven't seen it, and I'll read it and comment on it. I will say that we are going to participate in the mayor's pledge that former President Obama challenged American mayors to, involving the police department. I know Chief Newsham has done some preliminary reading through of the tenets of that pledge, and we will continue to look for ways to make sure that our police department has the tools that it needs to work with communities and to make DC neighborhoods safe. What we know for sure is we're proud of the progress of the Metropolitan Police Department, and it's been many years in the making. We're also proud of the trust between our police and our communities, because we need both to have safe neighborhoods. And it's quite a lot that has been done in partnership with the Council of the District of Columbia to have the type of accountability and transparency tools that make police departments better. So we'll be happy to review and consider what's on the table.
Can I just ask specifically about the idea of requiring disclosing the names of officers who are involved in use of force incidents?
We do and have disclosed names. Yes?
Two questions. One, Black Lives Matter DC has been highly critical of your event this morning, saying, basically, I'm paraphrasing, but too little too late. They point to disparity in funding, and they also are asking about releasing the body cam video of the police-involved shooting with Marquise Alston.
With what?
Marquise Alston, I believe that was a few years ago, a police officer shot and killed. Why has that video, body cam video, not been released? And what do you say to Black Lives Matter DC that you basically put their logo on the street and they say thanks but no thanks?
You're right. Black Lives Matter is very critical of police. They're critical of me, but that doesn't mean that I don't see them and support the things that will make our community safe, and that we don't all have a larger responsibility in the nation's capital to send that very clear message to our nation.
Has there been an incident with a guardsman who was sent home for some type of inappropriate behavior that is now being investigated?
If I could start, Chief, we'd heard some rumblings, but the General Walker confirmed with me that that there was some background incident on one of the guardsmen, and evidently I can have Chris explain this, but evidently when there is a deployment, there's background done on some investigations for officers that are moving, that are deployed. And there was a ping on one of the guardsmen.
Yes, Mayor, I don't have a lot to add to that. Chris can talk about the backgrounds that are done before a guard are deployed in the city. I was made aware of an issue where a guardsman has been sent home. A lot of that detail I cannot share publicly, but a guardsman has been sent home that was deployed to the area.
So if I could just back up a little bit. So all of these procedures, all of these guardsmen coming from around the country, when they're deployed to Washington, there's a background check done on them?
I'll let Chris talk about that.
Thank you.
So those background checks, to your question mark, are conducted in their home states. So by the guards in those home states in order to gain employment in a military capacity. So in this case, again, as the chief said, we can't get into too many specifics. But in this case, what we're hearing from, as the mayor mentioned, General Walker, and from federal authorities, is that there were some concerning activities that this individual partook in that necessitated the need to have him go home.
So is it activities this guardsman participated in here in DC, or something he was involved with prior to coming here back home?
We can't get into those specifics.
Is it an Ohio guardsman?
Yes, we can confirm that, yes.
It's a male?
I can't really talk any more specifics about it.
James, and we're going to take a couple more, and then I'll come to you. James?
Yes, at the funeral for George Floyd yesterday, the Reverend Al Sharpton said that he was going to convene a march on Washington sometime in late August. Has the National Action Network communicated to you or the administration about this, and have you heard about this?
That was the first time I heard about it. Yes.
I had a question for the chief. you said you're not sure how many and you're not sure, but is there any particular times you expect this to be the busiest tomorrow? And I also wanted to ask, there was an event this morning where future cadets were told, if you're not bothered by what happened to George Floyd, turn in your badge, like don't do it. And I wanted to get your reaction and your take on that.
So we anticipate that the events will start earlier. So these the information we have a lot of different information about a number of events that are occurring throughout the city at different times, and we can share what we have to this point. But I think if we're looking at this past week, those are very uncertain. So it's really, I can't give you some real specifics other than what we anticipate based on the information that we have. MPD had a private conversation today with our membership. The idea behind that private conversation was to let some members of our agency know how the leadership felt about the events that are occurring not only here in our city but across the country. So I don't want to talk about specific things that were said during that private conversation.
Okay, thank you, everybody.
We now return to our previously scheduled program, already in progress.